What will Central Texas need in the next decade to offer world-class health care for a growing population?
Some say it's going to take a medical school and a teaching hospital. Austin State Senator Kirk Watson is leading the effort to get one.
KXAN's Doug Shoup explains why healthcare leaders say accomplishing that goal is crucial to our community.
When Dr. T.J. Milling visits Houston's medical center, he can't help but think of what Austin could be.
With all those buildings, all that research, all that medical education going on. And across the street was Rice University. And it made me think about the northeast corner of our downtown.
That's why Dr. Milling and others are pushing for a medical school and teaching hospital to replace UMC Brackenridge.
The truth is you need to have that infrastructure surrounding a medical center to draw the best and the brightest physicians to a community.
According to Seton, Texas ranks 42nd in the number of physicians per capita. And in 2016, Seton anticipates a shortage of 770 physicians in Central Texas. The largest deficits will be in specialties like family practice, internal medicine, as well as infectious disease, pulmonology, and rheumatology.
Having a medical school here will enable us to provide more support personnel, more doctors. Doctors tend to stay in the areas where they're trained.
Having greater physician population in areas of specialty care, in areas of cancer research or geriatrics, people will no longer have to go to Houston or Dallas to get that specialty care.
Elizabeth Howard is a third-year pediatric resident at Dell Children's.
I think it's really important. It'll bring more of the, academic feel to Austin.
Seton has committed millions of dollars over the next several years to paying for residency programs both here at Dell Children's Hospital and at UMC Brackenridge. And the hope is those residents will stay here in Central Texas to practice medicine.
We are building more residency programs in Austin so that we can retain some of those physicians so that they don't go to medical school here, which is subsidized. It's our tax money subsidizing their education, and then go off to New York or LA or somewhere else and do their residency and then stay there.
The exact cost of a medical school and teaching hospital is unknown, but a committee of top community leaders has formed to explore that. However, supporters say it would bring 15,000 jobs and nearly $2 billion to the economy.
Once you get all those medical minds together thinking about medical problems, and of course, Austin is a tech city, so you get a lot of technological expertise and you get them thinking about medical problems. Well, those ideas will become products, and products will become companies, and then Austin will enter this huge economic boom.
For Howard, the future development could mean research, job prospects, and above all, the opportunity to practice in the community she loves.
No one should want to leave Austin.
Doug Shoup, KXAN News.
And you won't want to miss the interactive Engage breakfast discussion happening tomorrow morning. The topic, does Austin deserve its Fit City title? I'll be the MC of this event, being held at the Rollins Theater at the Long Center from 7:30 to 9 a.m. And don't forget about our live town hall discussion special. You can see here on KXAN Wednesday night, AT Expansion, Healthcare in Central Texas. It'll take place at the Hill Country Bible Church, their Northwest Campus in Cedar Park from 7 to 8 p.m. And to register to be in that audience, just go to KXAN.com and click on the AT Expansion tab.